It was our favorite institution. But quietly, it broke. Now, the system faces a margin call. This is how it happened.
Right, let's start with a number. 7.3 million. That's roughly how many people in England are currently sat on an NHS waiting list. Not 7.3 million appointments, 7.3 million people. Grandmothers waiting for hip replacements, blokes in their 40s waiting on a knee scan they were told would take 18 weeks and are now approaching year 2. Kids waiting for a mental health referral that still hasn't come. To put that in perspective, that's more people than live in Scotland, waiting. Now here's the thing that makes this genuinely strange, if you stop and think about it for a second. The NHS isn't just another public service to us, is it? It's not like moaning about the trains or the potholes or the council not collecting the bins on time. Ask anyone, anywhere in the country, what makes Britain Britain? And somewhere in the first 5 answers, right up there with the Queen or the weather or a decent cup of tea, you'll get the NHS. We love it. We built an entire Olympic opening ceremony around it, for heaven's sake. Danny Boyle put dancing nurses and giant hospital beds in front of 1 billion people watching London 2012, and nobody batted an eyelid. Because of course we did. This is the NHS. This is us. So today we're asking the uncomfortable question. What actually happens when the institution a whole country has built its identity around starts to visibly, measurably come apart at the seams? And, more importantly, is it actually breaking? Or is something quieter and in some ways more troubling happening instead? Let's get into it.
So let's deal with the numbers first, because they tell a story on their own. That 7.3 million waiting list I mentioned, it's actually come down slightly from its peak of 7.8 million back in 2023. The government will tell you that, and to be fair to them, it's true. But before you get too relieved, pre-pandemic, that figure sat at around 4.4 million. So even with the improvement, we're still miles above where we started. And the waiting list is really only the headline. Underneath it, the picture gets rougher. Accident and emergency, the bit of the NHS that's supposed to be there for you on your absolute worst day, is missing its own targets by a country mile. The target is that 78% of people get seen, treated, or moved on within 4 hours. The reality, more recently, has been sitting closer to 75–76%. Doesn't sound catastrophic until you translate it into actual people. That gap represents well over 1.5 million people a year waiting more than 4 hours in A&E. And then there's the bit that really ought to worry you. In April of this year, around 136,000 people waited more than 12 hours in A&E from the moment they walked through the door. On average, that's something like 4,500 people every single day sitting in a corridor, on a trolley, in pain, waiting. Ambulances aren't much better off. If you have a suspected stroke or a heart attack, a Category 2 call in NHS language, the target response time is 18 minutes. The average in the middle of this year was closer to 30 minutes. Not the worst case scenario, the average. And then dentistry, which barely anyone talks about, but genuinely should. Somewhere in the region of 8 to 12 million adults in England can't get an NHS dentist at all. Not the waiting list is long, cannot get one. In parts of Norfolk, Suffolk and North Yorkshire, there are simply no NHS practices left taking on new adult patients. You'd have to go private, or you'd have to go without. Put all of that together, and you start to understand why, back in 2024, when the new Health Secretary, Wes Streeting, stood up in front of the country, He didn't try to sugarcoat any of it. He said, plainly, and on the NHS's own birthday no less, "The NHS is broken." Now, that's a punchy soundbite, but is it actually true? To answer that properly, we need to go back, right back, to why the NHS exists in the first place.
5th of July, 1948. Park Hospital in Davyhulme near Manchester. These days it's called Trafford General. A 13-year-old girl named Sylvia Diggory becomes the very first patient treated under a brand new National Health Service. And the man who built it, Aneurin Bevan, a coal miner's son from South Wales, if you didn't know, which feels like it matters, stood there and set out 3 principles that frankly sounded almost radical for the time. 1. It would meet the needs of everyone. 2. It would be free at the point of delivery. 3. Care would be based on clinical need, not on your ability to pay. Now, to understand why that was such a big deal, you have to remember what came before it. Before 1948, healthcare in Britain was a genuine postcode and paycheck lottery. A patchwork of charity hospitals, local authority wards, and doctors you simply couldn't afford to see unless you had the money up front. Bevan looked at that mess and decided the fairest way to fund something like this wasn't insurance, where what you got out depended on what you'd paid in. It was general taxation. Everybody pays in according to what they earn. Everybody gets exactly the same standard of care, regardless. It was, genuinely, one of the boldest ideas of the 20th century. Britain became the first country in the Western world to offer completely free medical care to its entire population, no strings attached. And here's the bit I think gets lost in a lot of the modern arguments about the NHS. Bevan never actually banned private healthcare. He assumed, rather touchingly if you think about it, that the NHS would simply be so good that hardly anyone would bother going private. Nobody would choose to pay, he reckoned, when the free option was just as good. Which brings us neatly and rather painfully to where we are now. Because that assumption is being tested quite severely. So let's talk about the argument, because there very much is one, and it splits roughly down 2 lines. Side 1, broadly speaking, government ministers, NHS leadership, some economists, will point out, quite reasonably, that there has been progress. The waiting list genuinely is down 500,000 from its peak. Staff numbers have gone up, doctor numbers up around 24%, nurses up 22% over the last 5 years. Cancer treatment performance on the newer measurement standard is sitting at around 73% within 62 days. Not brilliant, but better than it was. Their argument, in short, we inherited an absolute mess. We're turning the ship around, these things take time, and honestly, given the scale of what COVID did to the system, a full recovery within a couple of years was never remotely realistic. Side 2, patients, unions, a fair chunk of frontline clinical staff, look at those same numbers and see something rather different. Yes, the list has come down slightly, but it's still nearly double what it was before the pandemic. Yes, staff numbers are up, but there are still over 112,000 vacancies across the NHS, and the 18-week treatment target hasn't actually been met, not once, since 2016. That's nearly a decade. And their bigger argument, the one that really lands with people, is this. The founding promise of the NHS wasn't reasonably good care, eventually, if you're patient. It was equal access based purely on need. And they'd argue that promise is being quietly broken, not through some big dramatic announcement or act of parliament,
but through sheer grinding delay, through people simply giving up and going private because they physically cannot wait any longer. Both sides, to be fair to them, are using real numbers. They're just choosing to stand in different rooms of the same house. So, which room is closer to the truth? For that, we need to dig into why this is actually happening. There isn't one single villain here, much as it might be satisfying to find one. It's really what you'd call a perfect storm. Several separate problems, all landing on the NHS's doorstep at roughly the same time. Problem 1. The COVID backlog. During the pandemic, huge amounts of non-urgent treatment were simply paused, understandably at the time. But that didn't make the underlying health problems go away. It just meant the queue kept growing quietly in the background, and the NHS has been trying to dig itself out of that hole ever since. Problem 2. Staffing. Over 112,000 vacancies at last count. Nursing and mental health roles are consistently the hardest to fill. And when you're short-staffed, the knock-on effects ripple through the entire system. Which brings us to something you might not expect. NHS workers themselves are owed a genuinely staggering amount of unpaid labour. Analysis from the TUC found NHS and public sector staff put in billions of pounds worth of unpaid overtime every single year, just to keep services running. Teachers and health and care managers, specifically, top the list of professions doing the most unpaid extra hours in the entire country. Problem 3, and this one rarely gets the airtime it deserves: social care. Back in 1948, elderly and long-term care sat inside the NHS's remit. Since reforms in the early 90s, it's been hived off to local councils, means-tested and chronically underfunded. Which means, in practice, that when an elderly patient is medically fit to leave hospital, but there's no care package waiting for them at home, they simply stay, stuck in an NHS bed, blocking that bed for the next patient who actually needs emergency care. It's called a bed-blocking crisis, and it's one of the quiet engines driving those horrendous ambulance handover delays we talked about earlier. Because if the hospital's full, the ambulance can't hand its patient over. And if the ambulance can't hand over, it can't get back out on the road for the next 999 call. And then, problem 4, industrial action. Resident doctors, formerly known as junior doctors, took repeated strike action over pay through 2023, 2024, and into 2026, adding further disruption on top of everything else. Individually, any one of these might have been manageable. Stack all 4 on top of each other and you get exactly the numbers we opened with. Now here's the part of this story that I genuinely think most mainstream coverage gets wrong, or at least glosses over. The conversation tends to frame this as a binary. Either the NHS survives, as it always has, or it collapses into some fully privatised American-style system. But the evidence suggests something quieter is actually happening. Not a collapse, a drift. The self-pay private healthcare market in the UK, people paying out of their own pocket, no insurance involved, just straight out of savings or, increasingly, on finance, has more than doubled in 5 years. It's now estimated to be worth somewhere north of £2.5 billion annually. And here's the detail that really ought to give you pause. This isn't just wealthy people topping up their care for convenience. Recent polling found that fully half of 18 to 34-year-olds now find private healthcare cover genuinely appealing. more than double the rate among the over 55s. And a good chunk of them aren't even going private for surgery. They're going private just to see a GP. Because a 2-week wait for a routine doctor's appointment simply doesn't square with how an entire generation expects the world to work. Nobody voted for this shift. There was no white paper, no parliamentary debate that said, let's quietly move Britain toward a 2-tier health system. It's happening by accident, by sheer accumulated delay, one waiting list at a time. And that, if you ask me, is precisely what makes it worth talking about. A system can drift a very long way from its founding principles without anyone ever officially deciding to change it. So why does any of this actually matter to you sitting there right now, probably in perfectly good health? Because delay isn't neutral. It isn't just an inconvenience you shrug off. Delay actively makes people sicker, and it makes treating them more expensive. Take something as ordinary as a torn meniscus, a common little knee injury. Left untreated for a year, that can quietly progress into full-blown osteoarthritis, and what would have been a straightforward, relatively cheap repair turns into a full knee replacement instead. Multiply that pattern across cardiology, across cancer, across mental health referrals for teenagers who are told to simply wait. And you start to see the genuine, compounding cost of a system that's stretched this thin. And then there's the financial side, which is arguably just as brutal in its own quiet way. Self-pay patients, ordinary people, not the wealthy, are increasingly borrowing, remortgaging, or draining retirement savings just to get a hip done before it wrecks their ability to work. That's not really choosing private healthcare in any meaningful sense. That's being pushed into it. So the real cost of this crisis isn't measured only in waiting list numbers. It's measured in cheap, curable problems quietly turning into expensive, chronic ones, and in ordinary British families draining their savings for care that used to be, in principle, entirely free. So, is the NHS broken, like Wes Streeting said? Honestly, I don't think that's quite the right word for it. Broken suggests something sudden, something that snapped. What we're actually watching is slower and, in a way, harder to fix. A genuine tug-of-war between an outdated, decades-old funding settlement and a population that is older, sicker, and more expensive to treat than it's ever been before. The NHS isn't disappearing. Let's be crystal clear about that. It still treats the overwhelming majority of this country free, at the point of use, exactly as Bevan intended back in 1948. But it is bending, quietly, unmistakably, toward a system where if you can pay to jump the queue, more and more people increasingly do. And that is precisely the kind of 2-tier drift the whole thing was originally built to prevent. Fixing that isn't really about one clever policy or one dramatic funding boost, however tempting that headline might be. It's about the unglamorous, decade-long slog of properly training and retaining staff, fixing social care so that hospital beds stop being clogged with patients who no longer need to be there, and being honest, properly honest for once, with the country about what this national institution actually costs to run properly. Because here's the thing worth sitting with. The NHS has always been less of a hospital system and more of a promise. A promise that in this country at least, your bank balance shouldn't decide whether you get to see another Christmas. That promise is genuinely, measurably under strain right now. Whether Britain chooses to properly fund it back to health, or simply lets it keep quietly drifting, that, more than anything else, is going to say an awful lot about who we actually are. Thanks for watching. Please like, share, comment and subscribe for more videos like this on The Margin Call.